Ever experienced discomfort or bleeding during bowel movements? You might be dealing with hemorrhoids. These are swollen and inflamed veins that occur in the rectum and anus, leading to discomfort and sometimes bleeding. They can be triggered by various factors. Perhaps you've been straining during bowel movements, or maybe you're dealing with obesity. Pregnancy and a sedentary lifestyle can also lead to hemorrhoids. Now, hemorrhoids aren't all the same. They can be internal or external. Internal hemorrhoids occur inside the rectum, while external ones develop under the skin around the anus. Both can be uncomfortable, but external hemorrhoids can be particularly bothersome as they form a lump near the anal opening. Hemorrhoids can be a nuisance, but understanding their symptoms can help you manage them effectively. Stay with us as we delve deeper into the symptoms of hemorrhoids in the next segment, and later on, we'll discuss ways to manage and alleviate these symptoms. The symptoms of hemorrhoids can vary, but there are a few common ones you should be aware of. First off, bleeding during bowel movements is a telltale sign of hemorrhoids. This isn't your ordinary nosebleed, mind you. The blood might appear on your toilet paper or make a surprise appearance in your toilet bowl. Not exactly the kind of surprise anyone looks forward to, but it's an important symptom to note. Next up is itching or irritation around the anal area. This isn't just your run-of-the-mill itch either. It can be caused by mucus from the hemorrhoid, making the area feel uncomfortable and, well, itchy. To put it simply, it's an itch that you really can't scratch. Then there's pain or discomfort, particularly when you're sitting. This isn't the usual soreness after a long day at work. It's a kind of discomfort that might make your favorite chair feel like a bed of nails. Lastly, there might be swelling or a lump near the anus. External hemorrhoids can sometimes form a lump around the anal opening. It's a bit like having an uninvited guest at your back door. These symptoms can be distressing, but they're your body's way of letting you know that something's up. If you're experiencing these symptoms, don't ignore them. It's time to take action. Fortunately, there are ways to manage and alleviate the symptoms of hemorrhoids. Let's explore some of these home remedies. Firstly, increasing your fiber intake can be a game changer. A diet rich in fruits, vegetables, and whole grains softens the stool and makes bowel movements easier. Secondly, hydration is key. Drinking plenty of water helps keep stools soft and easier to pass, reducing the likelihood of straining. Speaking of straining, try not to push too hard during bowel movements. Take your time, relax, and let your body do the work. Another effective remedy is a sitz bath. Soaking in warm water for about 10 to 15 minutes several times a day can relieve symptoms and provide much-needed relief. Lastly, there are a variety of over-the-counter creams, ointments, or suppositories that can help reduce swelling and discomfort. But remember, if symptoms persist or worsen, it's essential to consult with a healthcare professional. Let's take a moment to summarize what we've learned about hemorrhoids. These are swollen, inflamed veins in the rectum and anus that can cause discomfort and bleeding. Symptoms may include bleeding during bowel movements, itching, pain, and swelling near the anus. To manage them, consider increasing fiber intake, staying hydrated, avoiding straining, taking sitz baths, and using topical treatments. Remember, hemorrhoids are common and can be managed effectively. However, if your symptoms persist or worsen, don't hesitate to seek professional medical advice.